My name is Dr. Duska Dyer of Body Logic MD of Atlanta. I'm board certified in family medicine and I receive an additional training through American Academy of Anti-Aging Medicine and through a fellowship in anti-aging functional and regenerative medicine. Anti-aging medicine is a medical subspecialty that will assess, evaluate, prevent and treat all the disorders and diseases associated with aging. One of our smart professors referred to himself as an anti-inflammatory specialist. That is because there is a growing knowledge and growing studies showing that inflammation in our bodies will lead to chronic diseases, diabetes, high blood pressure, high cholesterol, and cancer. How do we get inflamed? Our lifestyle, traditionally our environment, can get us inflamed. Food that we eat, how much sleep we get, how stressed we are. All of these factors can inflame our bodies and, as I mentioned, can really lead to chronic disease. Functional medicine is this integrative approach to a patient where we address the patient as a whole, the whole body, the mind, the spirit. And it's also the thought that health is not just the absence of the disease. Health is really that optimal vitality. I want my patients to tell me that they feel fantastic. It's not just about the absence of the disease. Practicing functional medicine means going all the way back to the cellular level, looking at the biochemistry of the cell, trying to find that cause of the patient's symptom on a cellular level, not really just addressing the symptoms. There are so many causes of dysfunctional body. When we typically assess our patients, we certainly would order some traditional lab work. We would put a big emphasis on inflammation in the body, hormonal disbalances. We would, depending on the patient's specific need, assess their vitamin or micronutrient deficiencies on the cellular levels and address that and treat that. Again, depending on the patient's specific needs, we would look for food intolerance, toxic metals in their bodies, and things like this. Patients would come to us with really wide range of symptoms and problems they want to address. We have, of course, a large number of our women struggling with symptoms of premenopause or already in menopause struggling with the debilitating menopausal symptoms. And in those cases, we would check the hormonal levels, address the hormonal disbalance, and of course all in that in conjunction with detailed assessment of their lifestyle. How much are they sleeping? What food are they eating? What type of exercise are they doing, or are they doing it at all? Sleep is so essential to our body. If we don't sleep well, we will age faster and we are really more prone to all the chronic diseases that I mentioned. So it's really not just about addressing one's symptoms, it is really about assessing the patient in whole. In our practice, we do prescribe bioidentical hormones for our patients who are hormonally disbalanced and do not want to get on synthetic hormone replacement. But we do place a great emphasis on their lifestyle. The diet is addressed in details, what they eat, how they eat, and also on the natural supplements. We have a large number of patients who would come with a large number of supplements they're taking, and it's very important to know what you're taking, what is the quality, what dose to take, and what do you really need. Not every supplement is needed for everybody. Also, 70% of our immune system is in our GI tract. We really focus on having a healthy gastrointestinal tract. This is where some supplements are really helpful, like your probiotics, and again, anti-inflammatory food, or checking for some food sensitivities will affect your GI functioning, therefore the functioning of 70% of your immune system.
About 2 years ago, it just seemed like everything started to just fall apart. I all of a sudden started feeling like I was 90. My body was achy, everything snapped, crackled, and popped when I moved. I was cold all the time. I just was not right. And so I had done a search for somebody that did bioidentical. I didn't want to take any of the synthetic crap. So I went and got all my labs done and did everything, and I went in for an appointment, and I was really surprised at how out of whack I was. And one of the things that never crossed my mind was my thyroid. And I had been tested before for the TSH levels. Nobody's ever caught it because it always shows up normal. Well, she was totally on top of the new thinking of it's not just that number, but it also has to do with these other numbers that most other doctors don't even check. And as it turned out, it was the case. I wasn't converting some enzymes, so I was hypothyroid, but didn't even know it, and it wouldn't have been, no other doctor would have known it either. And so sure enough, she put me on the thyroid, and that one was probably the biggest difference. I mean, it was amazing. All of a sudden, I got up out of bed, and the snap, crackle, and pops all stopped. I was just like, wow. Just the deep aching in my body all went away. The weight started coming off. Doing the things that I normally do, I'm almost back down to my normal weight. I feel like I'm 35 now. Instead of feeling like I'm 90, I actually feel younger.
If you want to know more about our practice, you can go to the website bodylogicmd.com and click on Georgia.